Hey everyone, this is Emily Nelson from One Stop Family Clinic. I just wanted to share some information with everyone. It's something I've been wanting to share a while now, so just finally am taking the time, and I just figured, you know what, I just got to do it. So anyway, I and Bree, the other nurse practitioner at our clinic, are very, very passionate about helping people lose weight. So like one of the best things for me that gives me fulfillment as a nurse practitioner and primary care provider, or just like obesity, I would say specialist, is just the gratification I get from when you come in to see me. After seeing me for a few months, we start talking about taking away medication. Instead of adding medication, we're starting to take stuff away. And that is like one of the best things. So I'm going to try to share some different aspects of finagling the process of getting medication covered, and just different ways that the medical system and One Stop Family Clinic can help you reach your health goals. But first, I'm going to just start with, first of all, the American Medical Society has said that obesity is not just a precursor to disease. So it is actually a disease itself. That has been over 10 years now, that has been like a statement and has been shown to be like evidence. So what does that really mean in just like layman's terms? It means like, you know, there's things we can change and there's things we can't change. You know, obesity is complex, and it needs to be addressed as a disease in itself, not just like a precursor or just like a risk factor for other things. So we know, for instance, like if you're obese, you're more risk for high cholesterol, heart attack, stroke, all kinds of problems, diabetes, vein disease, man, like the list just goes on, right? But we really haven't had a lot of good healthcare like strategies to get people like the help they need. It's just like, oh yeah, guess what? You should lose weight. Well, that's great. Tell me something I don't know. Losing weight is hard for a lot of people. It's easier said than done. And there are really good medicines these days that really help with it. Early on, it was easy for us to get these medications approved by insurance, but unfortunately now it's not so easy. Over the last few years, it's not so easy. And I'm going to try to help everyone understand this and navigate the system. So I want just to kind of give you a little glimpse of what all it entails. So I just would like you to first like our page and follow. We're on YouTube and also Facebook, One Stop Family Clinic. So tonight I just want to quickly and briefly just start with, first of all, only about 30% of insurance cover obesity medicine, even though it's been over 10 years that the American Medical Association has said obesity is a disease in itself. Unfortunately, it has taken insurance companies a while to get on board as far as like the recommendation and like coverage for medications that help obesity. So even though your medical provider, your nurse practitioner, physician wants to prescribe you something that really could help your health and overall well-being, help your, you know, all kinds of medical issues, unfortunately, it's not just our decision. So I want to start with that. What does that mean? So when it comes to insurances, there are, and as far as obesity, unfortunately, there are many insurances that just flat out exclude obesity. And a lot of people don't understand that. And why is that? So what the reason is, you know, covering obesity adds costs to healthcare. So somebody's got to pay for it. So ultimately, a lot of employers either opt in or opt out to cover obesity. So by opting out, that means they don't cover the medications to treat obesity. That means, you know, the premiums are less, which might be seen as a win-win for an employer or an employee. But By opting in, maybe the premiums are a little more, maybe the employer covers some of that, or maybe the employee and the employer share that cost. Nevertheless, if they opt in to cover obesity, you've got a good policy, and that's good. So, but so many patients come to us and they're so frustrated, like, why won't my insurance cover this? Why wouldn't they rather would they rather me be unhealthy? Like, wouldn't they rather me lose weight and get my medical problems controlled? So it's a little more than that. Unfortunately, obesity is one of the only, most frequently excluded medical conditions that I see. There are a few others that I see sometimes with certain policies, especially more of the ones that are just like private pay, not like employer based. But it is something that employers either have to opt into or opt out to cover obesity. So I'll just start with that. And if you will like and follow us, you will learn more about this and how we can help you navigate this system to help you the best we can.